Well, hello everybody, and welcome to another episode of the Informed Chiropractor. I'm Dr. Don MacDonald, your host, and today I just met up with this wonderful guest. This last weekend, we were in Birmingham, England, at the UCA 25th anniversary conference, and on the day before the conference, we did a MacDonald Safety Corridor Level One. And this was the first time I got to really meet this guest. Brandy has met her lots in the past, and I've heard about her in the past. But when you're teaching a seminar and you see just like a light energy in the audience that's always smiling, and it always brought my attention. I'm like, she's so on fire about chiropractic and excited about the profession. I wanted to get her on the podcast. So she's a graduate of AECC in 2002. We're going to go through her story, but she's practicing in Carlisle,
Carlisle.
Carlisle. We're in the
Carlisle.
Carlisle, England, and yeah, and she's a co-founder of the Haley and Kelly trainings because they help to train other chiropractors. She's big into helping chiropractors working with kids, and it's my pleasure to welcome Dr. Kelly Jane McLaughlin to the podcast. Welcome.
Thank you. Thank you for having me. I'm very excited just to hang out with you really for half an hour or so and just chat.
No, this is cool because like it's always busy on the weekend and so you never get to like spend good quality time. But I love to get this because when you see someone after been in practice for quite a while and you still see they're on fire, I love that when chiropractors are in practice for a while and they're still passionate and learning and excited what they do. I always want to hear their story, and I know that people who are listening around the world will be interested to hear the story as well. So, as I like to always do, tell me about your beginnings in chiropractic. What was it that drew you to this profession?
Well, I don't have one of those miracle stories, where people say, "Oh, I had an adjustment from a chiropractor, and then I just had to be a chiropractor." I was fortunate enough. I grew up in Germany, and so I had a careers fair come, and my headmaster at the time had taken me aside and said to me, "Oh, I think you'd be really good at being a teacher." And I felt a little bit inside me die, and thought, "Oh my goodness, I definitely don't want to do that. Like work with kids all day, that would be crazy." Ironically, that's kind of what I've ended up doing anyway, but. So I started finding out more about different things that I could do, and I went to do work experience as a physio. It was for me, it was really boring. I went to do dentistry work experience and passed out, and so just kind of found like different things. And I met this lady in Germany who was actually she was a chiropractor many years ago. She didn't speak very good English, but she came in and she just I went to her place, and she was just trying to explain to me kind of what she did with people, and I just thought this sounds really cool. And then one of the tutors from my college that I ended up going to came to the careers fair and was telling me about chiropractic, and I just thought, that sounds really good. So I still didn't know anything about it. And it's a bit cheesy, but I kind of feel like chiropractic found me, because when I went to chiropractic school, I had an idea about what it was. And then very quickly in my first year, realized that that wasn't what it was. And then spent, I guess, my 5 years trying to basically keep my head down to qualify enough to be able to do what I wanted to do with chiropractic. So yeah, that's kind of how it came about, really.
How, like, so when you said you thought chiropractic was a certain way and then you got to school, you thought it was another way. What was that to those contrasts?
Well, I think when I met this lady, and I can't even remember her name now. She was just really excited about chiropractic and helping people. And she was talking a lot about energy. And part of her work that she did as chiropractic was she did breath work in there as well. And I remember thinking, this is really special. And then had my first year and went, oh, wow, this is like not special. This is actually just really hard work. And then thankfully had, I suppose, two big experiences in my college years where I heard Adrian Wemban talk, and I heard it, I think I was in my second year maybe, and he was presenting it was when we still allowed external speakers to come into the college and talk a bit of philosophy.
Back in the good old
Um,
days.
Back in the good old days, yeah. And I remember him saying like the likelihood of anything being by chance was the same as a whirlwind going through your back garden and constructing a Boeing 747. And I didn't really know what that meant, but I remember thinking, that's like really significant. That's pretty cool.
Yeah.
And then kind of that pipped my interest and started like that. And then in my third year, Guy Reitman came and he was stood at the front of the class and he was talking about chiropractic. And he said, hands up here, who's ever had antibiotics? And I'm like a child of the 80s. So I basically had them every day for breakfast. So my hands up. And he said, do you think it healed you? I was like, yeah, of course it did. Awesome. And he said, he stood there and he said, I would never give my child antibiotics, and then talked about the innate intelligence of the body. And I was so cross. I remember thinking this guy was crazy. Like, I can't believe he's here talking about these things. What does he mean that chiropractic is going to heal people? And like, it was a real epiphany. And ironically, I've turned into one of those parents whose kids have never seen a medical doctor or had a drug. So, like you kind of come full circle. But it's, yeah, those two things really, like very significant for me in my time there. And then just learnt more about it really. Lots of, very honoured to be able to expose lots of people as a student. That made me think in a different way or open doors for me. Yeah, and that kind of progressed from there really.
That's cool. So it was like kind of like two kind of events that didn't immediately change your mind, but almost like planted a seed in your mind that kind of
Yeah,
fermented over time. Because that's funny
yeah,
because some people will get upset when it's such a paradigm shift. Like it's almost like,
yeah,
because if what you say is correct, then that means what I thought before is incorrect, and nobody likes to be wrong, right? So it's like, damn.
yeah.
So you graduated, and so what did you do right after graduation? Did you associate or get your own practice or?
I was an associate and I said to myself, someone had told me, and I can't remember who it was, but they said, whatever you do, don't choose the job just because all your friends are there. Choose the job because it's the best job for you. Forget about the location because you can always move. And I was like, oh, okay. So it's a little bit of a joke, really, but I spent like the week going to job interviews from Bournemouth. So Bournemouth's on the south coast of England, and then I went for like an interview in London and then we kind of moved up and then we hit York and then I hit Newcastle and then I hit further north, which is Carlisle. And each place I went up, I thought, oh, this is a pretty good job. I could work here. This looks good. And I'd taken a job actually in Yorkshire and was like, yeah, that's great. And a friend of mine had organised for me to go and see these people in Carlisle. And I thought, well, I've arranged, so it would be rude not to go. And I met them and just thought this is it. Like energetically, I just walked through the front of their. Well, I met into their house first. They were great people, and then I walked in the practice and thought, I have. This is where I have to go. I mean, it's like in the middle of nowhere. It's 10 minutes from Scotland. Nobody was coming out of London in my year really, and I was like, wow, okay. And I remember he gave me the contract, and I don't remember anything about the contract apart from there was 3 points at the end, and one of them said, "I will respect the innate intelligence of the practice." And I got on the phone to my mum and I was like, oh, these guys are crazy. Like, I really want the job, but they're really crazy. And she was like, no, you should definitely do it. What does it mean? I was like, I don't know what that means. And so I was an associate for this amazing couple, and he taught me, he's one of the best communicators I've met in chiropractic, and he taught me like how to explain chiropractic to people
Hmm.
in a really like digestible way. I know when we spoke at the weekend, things have changed over time, particularly recently, but I just am so grateful to him for being able to help me educate people. And then he does it in such a way that new families want to come in because once they get that idea, they're just like, wow, okay, this is cool. Let's get everybody in because we all should be getting checked. So that was, yeah, I was very fortunate to find them.
Well, and it's funny because we were just saying on the weekend, or just before even the call, that chiropractic is in a unique situation in healthcare where it worked from the very beginning, and then we didn't know how it worked, and so we had to create a story around how it worked. And so maybe at the beginning the story wasn't exactly of how it worked, but as we're saying, as we keep learning and more, we just kind of keep learning on how it works. And so like I said, as long as the person still understands and the person still gets that results, like the story was still fine with the knowledge we had at the time. And now it just kind of evolves as we get more knowledge.
Yeah, absolutely. Absolutely.
So you practiced there. How long did you practice there? Because you've kind of said that you've kind of come full circle where you started there and then now you're back there. So did
So
you
I was there
stay?
for about 3 years, and then I went off and locumed. So I did a lot of locum work. Moved over to Newcastle originally to locum, then down to Canterbury, and then kind of did a lot of around the country, different jobs. Had the opportunity to go traveling with a rugby team, which I did. So we ended up went to the States, went to New Zealand. That was really
Cool.
cool. Yeah, that was really good fun. And then came home, locum for a bit longer, and then had a practice down south with my husband for about 10 or 11 years. And then we moved back up here more recently.
So how did you meet Liam? I met Liam this weekend. He's an amazing guy. Like, where did you meet him?
I met him he was in his fifth year and I was in my first year and I was really badly hungover. And my person that I was living with was not a chiropractor and she wanted to go and see someone in the college clinic because at those you could have someone to bring them in. And so
Yeah.
I'd asked for the guy that I knew there. But he had his numbers already. So the receptionist said to me, "Don't worry, I gave you another nice Irish guy." And I was like, I don't care if he's Irish, like she just wants to see somebody. And I remember he was singing and dancing. I remember thinking, this guy's mad. But then, yeah, as they say, the rest is history after that. So he
That's
was, yeah, it's
so
good.
like when you went and did your associateship, did he go there too, or how did he
Well,
like
no, I went up north, and then we sort of kept loosely in touch, but we weren't really necessarily in touch for that long.
right?
And then sort of I did my traveling and bits and bobs. And then just after he finished his Carrick, we sort of met back up again. And then, yeah, he was, like we talked about just before the call, he was doing all that study to find out about chiropractic. And yeah, it's not, it's very heady, very academic-y. But yeah, that's so there that's how we met back up.
That's
Yeah.
what we were talking about. We call it the simplicity on the far side of complexity. We just keep learning
Yeah.
more and more and more to realize that what we're actually doing is still good, and then we just keep doing it again, and we just learn more and more why what we do is good.
Yeah. Yeah.
That's awesome. So, when you moved up there, did you decide to just open your own practice, or did you buy an existing practice? How did that start?
No, I did so my first boss, Christoph, that is still up here now. His father passed away during COVID, unfortunately, and then he wasn't able to go back. So I came up and did a locum for him so he could go back for his dad's memorial. And I was still working down south at the time. And when I came up, like we keep in touch with them a lot, we've been up lots to visit them. And when I was up in the practice, Sarah, who runs the practice, his wife was there, and like she literally had like six pieces of A4 paper, and I was like, "Oh, what's that?" And she goes, "Oh, this is our waiting list." And I was like, "What?" She goes, "Oh, yeah, we like have a 3 month waiting list." And she goes, if you guys would had just like come back up," and I was like, "Ah, okay." Um, so course of events, made some decisions that didn't work out so well for us down south. So we were like, well, actually, where do we want to live? And then we were like, why don't we just go up north? So we made a decision, and 5 weeks later, without a house or a practice, we moved. And they phoned everybody on that waiting list and told them that we'd come up, and we were fully booked with our own waiting list within 6 months.
Wow.
So
See, that's
yeah,
location,
and that's
location, right? That's great.
it is, but that's what chiropractic should be, right? Like all
Mhm.
chiropractors supporting other chiropractors, and like because it's not, I think this is the thing about chiropractic, like it isn't about us. There's a scarcity of chiropractors, not of new clients. And so like
Mhm.
if we all just talk chiropractic and support, even when we don't always have the same agreement with what we're doing, or it doesn't really matter. Like if everyone's true with what they're doing, then everybody benefits because it like gives that ripple effect. So yeah, so that's how we came back up here, and yeah, it's pretty cool.
That is great. That's so good. I'm also interested because you train a lot of other chiropractors with pediatrics and things like that. Tell me a little bit about when you started mentoring other chiropractors and kind of what led to that.
So a friend called Natalie, she kept asking me if I would show her what to do with pregnant ladies, because Christoph's so good at communicating. He doesn't really want to see like the little babies. He loved seeing the adults and stuff. So I'm fresh out of practice, out of college, sorry, and didn't know anything. So did a lot of training in like a very short space of time, and then started seeing all these babies. And then just thought, oh, we're just missing the trick here because it's like it's dealing with the end result, the whole ambulance down in the valley, right? So I was like, well, how can we go back behind that? And I thought, well, let's just start seeing the pregnant ladies. And so we were seeing quite a lot of pregnant ladies for quite a while. And my friend Natalie said to me, oh, can you show me what to do? I was like, yeah, of course I will. I'll help you. And she was like, no, no, do the seminar. And I was like, no, I don't want to do that. I don't like, I don't want to teach. You can probably
Yeah, I totally know
relate to
that
this a
one.
lot. So Natalie was kind of like my brandy, I guess.
Yeah.
And she just kept saying it, she's very gentle, but kept saying and saying. So after a couple of years, and I just ran one of my first seminars, and I loved it. I just thought it was brilliant, and people were really like they were really grateful and they were really happy to do it and really keen to learn. And then it just kind of morphed from there, really. So yeah, so like we see lots of babies, but I feel really passionate about the pregnancy side of it because I do think it highlights to me more so than ever where we have a lack of trust in health and in our own bodies. And I think that's really highlighted in pregnancy. And I just think if we can just give people that information, then they have that opportunity to do what's right for them in that time, even if it's not what we want them to do.
Mm,
But they have that opportunity just to know, and then they can make the decision that's right for them. Because, like with health, a lot of people just don't even know what to ask.
right.
So yeah, that's kind of how it came about, really. Yeah.
Well, it's funny because nowadays it seems like pregnancy is like a pathology. Like it's
Oh, oh my goodness, Don. Honestly, it's like,
even though
we have a
The funny joke with us is because Brandy was adopted, so her joke was that being pregnant seems so unnatural, which is hilarious because we wouldn't even survive as a species without that. But literally, people think it's a pathology.
It's mad. It's mad. And like when we first moved up here, like down south, I had a really good network of people that would help with pregnant ladies, and we'd all refer to each other, and it was brilliant. And I moved up here, and it was there's just like there's nobody. And then a couple of people have sort of found me, and then like we have a 51% C-section rate in this county. And I'm
Wow.
just like, because my clients say, oh, so they put me in for my induction at 40 weeks. I'm like, oh, like why? Why? And they're like, oh, I don't know. And I'm like, well, did you ask them why? And it's, yeah, anyway, and
Works good.
that's
My
so,
doctor's going on holidays on this July,
yeah,
whatever, so it works perfect for them.
it's, yeah, it is crazy. So, I feel like there's just people just don't know the stuff. This is the thing, and on my courses, like I will literally have one person at every course. It's usually a younger grad, and it's amazingly brave of them to ask, and they will ask me, like, what is the problem with C-sections? Like, why do I talk about it so much? Because they think it's probably safer than having a vaginal birth. And I'm like, wow. And so that's in our profession, and we're exposed to so much more information than most people. And so I'm really grateful to those people because they keep it really real, and it lets, there's so much work for us to do.
Well, and
There's so much work for
I
us
think
to
it would
do.
be just like, you zipping back to chiropractic school and listening to Guy Reichman and hearing about antibiotics, because if you've been brought up thinking C-sections are normal and then all of a sudden you hear a different thing, it's like such a paradigm shift in your brain that
Yeah.
I think when we're doing, we have to realize from their point of view too, like we don't want to wrong them, but just
Yeah,
have
absolutely.
a
Yeah.
really good way of communicating, just open their minds so that like Brandy's goal is always to have them say, well, I never thought of it that way, like kind of in an open,
Yeah.
not defensive way. So
Yeah.
yeah, so I think that's super powerful. So how long have you been doing these seminars?
I've been doing them probably about maybe 12 years now. 10,
Oh,
12 years.
that's
Yeah.
great.
Yeah.
Do you have a series, or is there like do you have
I,
one seminar, or what's your seminar series look like?
So I have two. I have the one, like the module one, which is the kind of five-step protocol. So basically how to do the assessment and then check. It's not a technique thing. It's really assessment-based protocol because, as we know, all techniques work. So
Yeah,
that's why they're all around still.
yeah.
So an assessment protocol and then lots of information. And then module two is a bit more advanced. So people that might see lots of pregnant ladies might want to do that more. The more unusual things you might see, and so, yeah, just a bit more detail on other things that were not covered in the kind of meat and potato section, I guess.
No, that's good. That's great. And now tell me a little bit about your working with Haley and
Mm.
Kelly trainings. Tell me a little bit about what is that?
So we run retreats. We've just launched our ninth retreat for next year, and I always say that they're Haley's baby. I'm very honoured to be invited along for the ride and to help and to join in. But she isn't a chiropractor, but she's much more embraces chiropractic much more than most chiropractors I know.
Hmm.
And she's very passionate about chiropractic, and they started because she felt that she wanted other people that weren't in chiropractic to have the opportunities she had because she felt that she had all these opportunities that were marvelous through chiropractic. And she just said, everybody needs this information, everybody needs to be helped, everybody needs all these opportunities as well. Like, how can we do it without the profession basically. So that's
Mhm.
kind of how they were born. That and lots of porn star martinis was kind of how it how it kicked off. I think we just made the decision one night. We're like, right, let's do this, and that's how they came across. So number 9 is next year, and it's yeah, they're just a lovely event. I know lovely probably doesn't do it justice. They're just very special because it's a very, for me, it's a really safe environment, and they're people that are really, really brave and want to step into their own power. And it's just a little bit of way to support them on that way to doing that. We do cool things. There's a fire walk, obviously, is a big thing for most people, but we do other events over the weekend as well. But it's just very nurturing. There's always excellent food, and lots of chats, lots of conversations, lots of support, and always marvelous women. Yeah.
And
So
talking in our polyvagal language, lots of co-regulation, which is like
loads. Yeah.
awesome.
It was cool. The last one we had, we were in Ireland, and Storm Amy hit. So we were literally, it felt like you were cocooned in this most marvelous house with these roaring fires going, and everybody was like all snuggled in together. And people just said like the connection was the thing that made the weekend for them. So yeah, it was magical. It
That's
was really
great.
good.
Now, if someone's listening to this and they want information about it, is there a website or something that they can look that up?
Oh, thank you, Dr. Don. Yes, they can go to hayleyandkelly.co.uk. I think it's .co.uk, not .com. And they can, there's sections there. So we've got the workshop section and we've got they're called Revival Retreat. So they're on there as well. And there are still 2 places left for next September. So we've almost sold out, but
All right.
not quite. Yeah.
Well, that's good. Well, if anyone is out there in the UK, that's something to look into. It's always good to get people around like-minded chiropractors because that's I think
Yeah.
that's half the reason why we do all of our seminars too, because we get to like hang out with the coolest chiropractors around the world. They're all like-minded, and it helps to fill our tank too.
Yeah.
Um,
Yeah.
Now you work with your husband,
I
right?
do.
And I work with my wife, and we have a lot of chiropractors that we know that they are couples in chiropractic. And so,
Yeah.
for if someone's say younger, coming out of school, and they're about to work with their spouse, what kind of the wins and challenges do they play? Have you guys noticed back and forth working together as a couple?
Well, Liam might listen to this, Dr. Don, so I might need to be. Just kidding.
Caveat:
Um,
Liam's amazing, so it's all good.
yeah. It was Dr. Sarah Farrant. She was a coach of ours for years, and she was really instrumental in just in the way we see life, I think now. She's just a phenomenal human. And when we were working with her back in the early days, she said to us, make sure you're really clear about who does what. And I was like, oh, okay, that should be quite easy. Yeah, no, not at all. Is it not easy at all? Because like I'll often think, well, that's not how we're going to do that. That's no, my way is definitely going to be better. But actually, having that divide in who does what in practice is really good. And it just really makes it much easier. So not that you can't help, but like when we used to have an X-ray machine, we don't have one now, but that was Liam's thing. So I could certainly help with stuff, but any problems, he would deal with them. He would do all that kind of side of it. And then we had a team at the time. So I would be more in charge of the training and those kind of things. So I think that clarity amongst like who's going to do what, and certainly playing to your strengths is probably the best advice we were ever given.
Yeah, I'm always curious because like in my mind, as me a chiropractor and then Brandy not a chiropractor, like there's certain things at the front that I don't even know how to do, so it's really
Yeah.
easy to keep delineated. And then she's not adjusting, so there's kind of automatic a little bit of a delineation in there. But it's always interesting when you have 2 chiropractors that could do everything. How I guess you just like you said, you go through and figure out what are the strengths of each person, and then you kind
Mm.
of say, I'll be kind of like the lead on this part, you'll be the lead on this part.
Yeah, and I think it's the only way for us to do it really, because there's certain things, and I think the other thing I've had to learn is compromise.
Mm.
So and it works. It's much easier actually, I think, without a team because it's not confusing for them at the front desk. Particularly if you're the one that's kind of trying to instill things and teach them stuff, and then you're doing it one way and someone else is doing it the other way, because that does cause a lot of problems. So over the years, we've been like, well, we need to have a kind of commonality. Whereas now, like Lynn will do things the way he likes to do stuff, and I'll do it the way I like to do stuff. And it's actually much easier because we don't have a team now. It's just us, we're sole practitioners without any CAs.
Oh, really?
So
Okay.
yeah, we've gone completely different to how the practice runs now, and it's working really well. Like it's actually really cool.
Hmm.
I don't think you can ever replace a front desk team. I think there's always going to be shortcomings when you don't have CAs always, but I think you can do a okay job and still serve people pretty well. So
Well, and that's
yeah,
interesting too, because the longer you practice, you can do whatever you want. Like it doesn't matter.
yeah,
Like you
yeah,
could do anything you want. But were you guys just trying to like kind of simplify your life? Is that like
yeah.
is that kind of something that led you to that point? Because it is a lot of work. Because when you're hiring staff and training them, and then they leave, and then like
Yeah.
and
And
then
you always
and,
personally, like, you take that personally, don't you? It's like they left
yeah,
me, even though you wish them well, and you want them to go on to bigger and better things. It's
yeah.
still like, oh, yeah. We had the opportunity to make some significant changes, and we were at a pain point. And at that pain point, we decided actually, right, what is it we really want to do?
Hmm.
And we home educate our kids, so there's a lot of time that goes on there as well. And it actually just made it really simple. We used to do, five people across 15 minutes, three benches, open plan. We've gone to one person every 10 minutes now. And we do everything, and it's
Hmm.
not in the adjustment, it's still just the adjustment, not just the adjustment, it's still the
Yeah,
adjustment is the thing.
yeah.
But because we're doing everything else, so it's much slower. And I can honestly say at the moment, it's the happiest we've been in practice.
Because
Yeah, for us now.
there's something for simplicity like that. Like that is like just getting it down to the bare bones of like why you do it. And like once you've been in practice for a while, like I said, as long as you're financially okay, like that's
Mm.
great. That's great, right?
Yeah, yeah,
But and then the lower overhead too, just because then it's a little bit
yeah,
more of it's a more profitable
yeah,
model,
yeah,
right?
yeah.
And a little bit easier on your body.
It's actually a lot easier on the body. Like we still see families, so we'll still probably do families in that, that gap. So
Yeah.
it's probably not a true representation to say it's one person every 10 minutes because it's not really, but
Mhm.
it kind of feels like that. And it's still like the adjustment is still fast, like they're still on the bench for a couple of minutes if that's what's appropriate for them.
Yeah, yeah.
And then, there's just a bit more kind of smoothness in and out of the rooms. And yeah, it's just sort of it's led itself to that because of the location where we are and just the physicality of the practice that we're hiring at the moment. And it might change in 5 years, who knows? But for now, it's really good fun. Yeah, and it's just good.
That's great. Um, Also, I was just going to ask a little bit. You did the first MacDonald Safety Corridor seminar this last weekend, and I thought I always have a hard time describing it sometimes because it feels like it's like there's so much to describe it to make it simplicity on the far side of complexity. So I just love to get your perspective of attending the seminar and kind of what were your highlights that you got from that weekend.
Oh, thank you. Yeah, what a brilliant. Well, first of all, you haven't been go because it's just amazing. I think the gift you and Brandy gave to us all is you take something really complex and you made it really simple, um, but not simple, if that makes sense. Like it was just, and you're both really real. Like I love the fact that you said, well, this is how we used to do it, but actually it's still kind of like that, but now we've morphed into this, and it's almost like you give people permission to do things, and you make it feel like you're. Doesn't really matter what your technique is, but you can do the assessment and feel the adjustments and how you were talking about them like you could and anyone I feel like anyone in that room felt like they could do that, but it's that extra bit, it's that like tapping into like what is it I'm missing. And when you were explaining certain things about the neurology and like how to approach people and just like the staying with them,
Yeah,
because that was like awesome. It was like, yeah, it's like just stay with them. And then yeah, it was just brilliantly clever, and it was very exciting for me because it was like, yeah, this makes sense. It's like all the stuff that we kind of have been experiencing post-COVID and like couldn't really understand, but like I know it's there and people aren't getting well, and like it's taking forever and what's happening, and the kids are really, really not in good shape, and it's like worse than ever, even though birth is still as terrible as it always was. So it's
right.
like, well, like why? And then you listen to what you were saying, and you're like, that makes perfect sense. So it gives you kind of permission, confidence, and the skill set to step forward. Yeah.
That's great. Yeah, I just think I find and it's funny because the more we teach it, the better we learn it, the deeper we get into it, the more you understand it, and then the more things make sense. And so what I find it's really cool is that now things aren't so shocking, surprising. Like because our end result is to generate more regulation in the nervous system, and that's very doable. Like if you're trying to fix back pain or if you're trying to treat conditions, that's like who knows like that sometimes it hits. That's why I think in chiropractic in the past, you'll get one person, like we talked about them. If they come in, you get two people, one person's already wired for dysregulation and the other one's fairly regulated. They both could say have the same so-called condition. They're not going to respond anywhere close to the same speed. And so
Mm.
just I think us as chiropractors realize that we sometimes take that personal. And so if we understand what's going on, we don't take it personal. It's not necessarily us. It's
Mm.
everybody's nervous system is like a separate Rubik's cube. I always say that we got to try to figure out, but just realize it is what it is, and they're all going to be slightly different. So yeah, I
Yeah.
love the way you describe that. That was good.
I feel like I have insider knowledge now, like you've been allowed to see that insider knowledge in the back. You've been given this sort of access to the secrets. That's how I felt after the workshop.
Yes,
It was
yeah.
very
Brandy
cool.
Brandy always calls it it's the algorithm of the nervous system, and so it makes things make more sense. So coming to the end, I always just like to ask two questions. So one, if you could zip back in time and speak to your, say, 18 or 20-year-old self, and you could give yourself one word of wisdom or a phrase, what kind of advice would you give your younger self?
I would say do it for you and don't worry about what everybody else thinks.
That's easier than said than done, isn't
Yeah.
it?
Yeah.
We're still trying to work on that one now.
Yeah. Yeah.
That's great. So is there any like parting words of wisdom or advice that or inspiration that you'd like to leave our listeners with as we close?
Oh, I would like to say yes, I would. Thank you. I would just like people to really do chiropractic justice,
Hmm.
to not be afraid to speak and share their knowledge and what they have, even when they don't think they have a lot of it, because they do, and they will change lives. And humanity is desperate for chiropractic. They just don't know about us because we keep ourselves so small. So please just tell people what you know and be brave.
Perfect. Tell people what you know and be brave. That's been one I've been working on for a lot of years as well. So,
Me too. Me too.
and we're a mass. I would say we're masterpieces in progress. So we're just continually working on it. Well, thank you very much for joining us on the podcast. Really appreciate it.
Thank you very much for having me. It's lovely to speak to you.
And so for everybody out there, I hope you got some good pearls of wisdom from this call. I appreciate it, and I love to hear the story and the process of chiropractors going through their life journey, and just realize when you're having challenges, ups and downs, we all had challenges throughout the whole way. So you're not alone. So until next time, have a wonderful day. We'll see you in a few weeks.
Thank you.